Hello everyone, my name is Dr. Vallabh Chawla, specialized in oral medicine and radiology, and today we'll be speaking about mucormycosis, which is also known as black fungus. Today, all over India, we all are witnessing a rise in the cases of black fungus, especially during post-COVID cases. Even in the news headlines, everywhere, it's all about the black fungus, white fungus, or the green fungus, but the most common one is the black one, which is also known as mucormycosis. So, let's talk about mucormycosis. Mucormycosis is a rare, opportunistic deep fungal infection which is caused by fungal spores, which is also known as mucorales. It is a serious condition which invades the orbit and has intracranial spread. Its mode of transmission is airborne, and these spores they land on the nasal mucosa or the oral mucosa. The most common population affected are COVID-19 patients who are recovered and are specially immunocompromised, having weak immune system, or those patients who are on systemic steroid. Coming to the risk factors, those patients with uncontrolled diabetes mellitus, those patients who are on voriconazole therapy or are on immunosuppressants, patients with malignancy or cancer, or patients with prolonged ICU stay, they all are at a risk of mucormycosis. Even the patients who have recovered from COVID-19 infection after oxygen or ventilation therapy from ICU, they are at risk factors because the humidifier bottle which is attached to the oxygen tube is may be filled with non-sterile tap water which may be rich in microorganisms. Coming to the sites involved, the most common site involved is the maxillary arch, the alveolar bone, the nasal and the paranasal sinus, that is nose and the maxillary sinus, eyes or brain, and lastly the lungs. Now, here are some of the warning signs and symptoms. The patient may feel headache, fever, coughing, shortness of breath, bloody vomits, and altered mental status. Then, patient will also experience severe toothache. One of the most common warning signs of black fungus or mucormycosis. He may experience mobility or loosening of teeth. Pus may ooze out from the gums or the alveolar bone. It may involve in the periodontal bone as well and also lead to periodontal abscess, which may cause foul odor. There may be brackish eschar or perforation in the palatal mucosa, which may lead to further mucosal necrosis. The maxillofacial adjacent structures may also get involved. It may involve either the soft tissue or the hard tissue as well. The fungus may spread to the adjacent nasal structures and may lead to nose blockage or congestion, reddening of nose, and pus discharge from the nose, which may appear blackish in color. There may be nasal necrosis, nasal mucosa necrosis, and blackish discoloration or perforation may also be noted. The infection then spreads from nasal structure to the adjacent sinus, that is maxillary sinus. So, when the sinus is involved, there may be signs of sinusitis such as low-grade fever. There may be numbness or swelling over the cheek, local pain on the cheekbone, and in advanced stages, perforation may also be noted. Patient may also complain about pain or redness around the eyes, altered eye movements, loss of vision, and blurred vision as well. So this is how the lesion spreads. Firstly, there may be pain and redness around the eyes, then one-sided facial pain, especially around the eye. Then it may lead to necrosis of that specific region around the eye and further spread of infection towards the brain. So when the brain is involved, it may lead to cerebral ischemia, infarction, and further death. So in extreme cases, the lungs may also get involved. The new variant, that is the Delta Plus variant, has more affinity for lungs and it may also worsen the respiratory symptoms. Now coming to investigations and treatment plan. Firstly, we need to understand that the mortality rate is high, so early diagnosis is important. Corona patients need to be vigilant to prevent mucormycosis. Treating mucormycosis is a multidisciplinary approach where we require physicians, oral diagnosticians, oral surgeons, ENT specialists, ophthalmologists, and neurosurgeons in advanced cases. Consult your physician and provide proper medical history to your doctor. Make a visit to your dental surgeon. Your dental surgeon will evaluate for any changes in the oral cavity. He or she may recommend you to go for a dental OPG or a dental CBCT when dental OPG shows no finding. A low dose oral CBCT will show you images in all the three dimensions, axial, coronal, and sagittal, to see complete opacification in the sinus or any changes in the maxilla such as erosion. CT and MRI are mainly used to diagnose the soft tissue and the hard tissue structures. These diagnostic tools are mainly used when the lesion has spread to the adjacent structures. For confirmatory diagnosis, a biopsy is recommended and then given for the fungal culture. Now coming to the management, firstly we need to understand not to miss any warning signs and symptoms such as dental pain, changes in the orbital region, changes in the color of the eye, and headache and bleeding from the nose. Maintenance of proper oral hygiene and use of mouthwashes as recommended by the oral physician. Steam inhalation therapy, which will help to improve the sinus health. Compulsory wear a mask and maintain hand hygiene. Control diabetes and monitor blood glucose level. Use steroids judiciously and use antibiotics and antifungals only on prescription basis. Use clean sterile water for humidifiers during oxygen therapy. Maintain adequate systemic hydration and proper diet as recommended by the dietitians. In advanced cases, an endoscopic debridement of sinuses may be required. Now, it is important to understand that mucormycosis, if untreated, it may turn fatal and hence infection can reach the adjacent areas. Patients with mucosal mucormycosis may require surgery of the jaw, and in some cases, even jaw and the eyes may have to be removed, and hence extensive surgical debridement may be required to remove all the necrotic materials, and the jaw is reconstructed after 6 months of the surgery with artificial eye implantation. Thus, to summarize, mucormycosis is, if untreated, the infection may spread from dental to nasal to sinus to orbit and to brain and other structures such as lungs. To conclude, early diagnosis plays a vital role. Don't ignore the warning signs and symptoms. All recovered COVID patients should get a regular dental and ENT checkup for sinus evaluation. Treatment of this condition will save many patients from going blind and losing their eyesight. Thank you so much for listening. If you like the video, don't forget to share it with your friends. Have a great day.